Good morning. Today's class, we will see the October 2019, that is the 2010 scheme of anatomy question paper. So the first question, there is two essays. The first essay is name the cranial nerves, describe the facial nerve under the following headings like course, distribution, branches, applied aspect of the facial nerve. So each carries 2 plus 2 plus 2, that means total is 6 plus 4, 10 marks. So, the cranial nerves include olfactory, optic, oculomotor, trochlear, trigeminal, abducens, or it's called abducens also. Then facial nerve is the seventh cranial nerve, vestibulocochlear, glossopharyngeal, vagus nerve, accessory and hypoglossal nerve. These are the 12 cranial nerves. Then we have to go into the facial nerve. Facial nerve is distribution sense of taste from anterior two-thirds of the tongue via contact tympani branch, sensation from external ear, and parasympathetic fibers to submandibular, sublingual, salivary glands, the lacrimal gland, and the glands of the nasal cavity and palate. The course. During its course, the facial nerve transfers the posterior cranial fossa, the internal acoustic meatus, the facial canal in the temporal bone, stylomastoid foramen, and parotid gland. At medial wall of the tympanic cavity, the facial canal bends posterior inferiorly. The sensory ganglion of the facial nerve, the geniculate ganglion, is located here. Branches, greater petrosal nerve, nerve to stapedus, then chlora tympani nerve. An applied aspect of the facial nerve includes supranuclear lesions of facial nerve is usually a part of hemiplegia. In this type, lower part of the face is paralyzed. Under motor neuron lesions present as paralysis of contralateral lower quadrant of the face with sparing of the contralateral upper quadrant. Additional sickness is hemiparesis, dysphasia, and sensory deficit will depend upon other adjacent neural pathways and regions involved. Mobius syndrome is a rare cause of congenital facial palsy due to hyperplasia of the facial motor nucleus. In this condition, the facial weakness is bilateral in 93% of patients, while 92% demonstrate bilateral eye abduction failure. That means the sixth cranial nerve involvement. Lower motor neuron lesions in the pons involving motor nucleus can be the result of range of pathology, stroke, neoplasia, and inflammation. Lower motor neuron lesions in the pons present the spread facial nerve weakness involving the entire half of the face. Second essays mention endocrine glands, describe thyroid gland under the following headings like location, relations, blood supply, and applied aspects. Endocrine glands are ductless glands of endocrine system that secrete their products hormones directly into the blood. The major glands of the endocrine system are pineal gland, pituitary gland, pancreas, ovaries, testes, thyroid, parathyroid, hypothalamus, and adrenal gland. Among these, hypothalamus and pituitary glands are neuroendocrine organs. And now we can see in detail thyroid. Thyroid is located in the front and sides of lower part of the neck opposite levels of C5, C7, and T1 vertebrae. The relations anterior laterally, the lobes are covered by strap muscles, that is sternochyphoid and sternothyroid. Blood supply by the atrial supplies a pair of superior thyroid arteries arise from internal carotid arteries. They enter the upper parts of the lobes. These arteries are closely related to the external laryngeal nerves. A pair of inferior thyroid arteries, they rise from thyrocervical trunk of the first part of the subclavian arteries. The terminal part of each inferior thyroid artery is related to the recurrent laryngeal nerve. Atria thyroida ima is the unpaired branch arise from the arch of aorta and brachiocephalic trunk. Venous drainage, veins from plexus beneath the true capsule. The plexus is drained by three pairs of veins, superior, middle, and inferior thyroid vein. Superior and middle drain into the internal jugular vein, but the inferior drain into the brachiocephalic vein. Applied aspects, excessive production of thyroid hormones called hyperthyroidism, causes include Graves' disease, toxic multinodular goiter, solitary thyroid adenoma, inflammation, and pituitary adenoma, which secretes excess thyroid stimulating hormone. Underactive thyroid gland results in hypothyroidism. An enlarged thyroid gland is called goiter. Inflammation of thyroid gland is called thyroiditis. The most common neoplasia affecting thyroid gland is benign adenoma, usually presenting as a painless mass in the neck. Malignant thyroid cancers are often carcinomas, although cancer can occur in any tissue that thyroid consists of, including cancer of C cells and lymphomas. Short note, the first is flora. You can refer to 2019 question of the 2016 scheme, question number 7. The fourth question is part of kidney. There are three major regions of the kidney. First one is renal cortex. The kidneys are surrounded by renal cortex, a layer of tissue that also covered by renal fascia, that is a connective tissue, and renal capsule. The renal cortex is a granular tissue due to the presence of nephrons, the functional unit of the kidney, that are located deeper within the kidney, within the renal pyramids and the medulla. The cortex provides a space for arterioles and venules from renal artery and vein, as well as the glomerular capillaries to perfuse the nephrons of the kidney. Erythropoietin, a hormone necessary for the synthesis of new red blood cells, is also produced in the renal cortex. Second part is renal medulla. The medulla is the inner region of the parenchyma of the kidney. The medulla consists of multiple pyramidal tissue masses called renal pyramids, which can triangle structures that contain dense network of nephrons. At one end of each nephron, the cortex of the kidney is a cup-shaped structure called Bowman's capsule. It surrounds tuft of the capillaries called glomerulus that carries blood from the renal arteries to the nephron, where the plasma is filtered through the capsule. The third part is renal pelvis. Renal pelvis contains the ileum. The ileum is the concave part of bean shape where the blood vessels and nerves enter and exit the kidney. It also point of exit of ureters, the urine-bearing tubes that exit kidney and empty into the urinary bladder. The renal pelvis connect the kidney to the rest of the body. Next question is tonsil. The tonsils are a set of lymphoid organs facing the digestive tract, which is known as Walde's tonsillar ring, and consists of adenoid tonsils, two tubal tonsils, and two palatine tonsils and lingual tonsils. These organs play an important role in the immune system. Microscopically, the tonsil is a mass of lymphoid follicles supported on connective tissue framework. In addition, the center of each of these nodules is densely packed with lymphocytes, are referred as the germinal center. Palatine tonsils. These are located between palatoglossal arch anteriorly and palatopharyngeal arch posteriorly. Lingual tonsils are the small round elevations that sit on the most of the posterior part of the tongue base. Then tonsils are the part of lymphatic system which help to fight infections. However, removal of the tonsil does not seem to improve susceptibility to the infection. Tonsils vary widely in size and swell in response to infection. The tonsils conditions or applied aspects include: first one is acute tonsillitis. A bacteria or virus infects the tonsils, causing swelling and a sore throat. Tonsil may develop grey or white coating. Chronic tonsillitis, persistent infection of the tonsils, sometimes as a result of repeated episodes of acute tonsillitis. Peritonsillar abscess and infection create a pocket of pus next to the tonsil, pushing it toward the opposite side. Peritonsillar abscess must be drained urgently. Acute mononucleosis, usually caused by Epstein-Barr virus. Mono causes severe swelling of the tonsil, fever, sore throat, rash, and fatigue. Strep throat, the streptococcus, a bacterium which infects the tonsils and throat. Fever, neck pain, often accompany the sore throat. Enlarged or hypertrophic tonsils. Large tonsils reduce the size of airway, making snoring or sleep apnea more likely. Tonsil stones. Tonsil stones or tonsillolithis is a form when wrapped debris hardens or calcifies. Next question is deltoid muscles, which also been discussed earlier. Next is layers of eyeball. The eye have three main layers. These layers lie flat against each from the eyeball. The outer layer of the eyeball is a tough, white, opaque membrane called sclera, the white of the eye. The slight bulge in the sclera at the front of the eye is a clear, thin, dome-shaped tissue called cornea. The middle layer is choroid. The front of choroid is the colored part of the eye called iris. The center of the iris is a circular hole or opening called pupil. The inner layer is a retina, which lies in the back two-thirds of the eyeball. Retina consists of two layers: sensory retina, which consists of the nerve cells that process visual formation and send to the brain, and retinal pigment epithelium, which lies between sensory retina and wall of the eye. This is the layers of eyeball. Next is femoral artery. Femoral artery is the large artery in the thigh and main arterial supply to thigh and leg. The femoral artery gives off deep femoral artery or profunda femoris artery and descends along the anterior medial part of the thigh in the femoral triangle. It enters and passes through the abductor canal and becomes popliteal artery as it passes through the abductor hiatus in the abductor magnus near the junction of the middle and distal thirds of the thigh. The relation of femoral artery are anteriorly, the upper part of its course is superficial and is covered by skin and fascia. The lower part of its course it passes behind the serratus muscle. Posteriorly, artery lies in the it separates it from the hip joint, the pectinus and abductor longus. The femoral artery intervenes between artery and abductor longus. Medially, it is led the femoral vein in the upper part of its course. Laterally, femoral nerve and its branches. Femoral artery gives several branches which include superficial circumflex artery, superficial epigastric artery, superficial external pudendal artery, deep external pudendal artery, and profunda femoris artery is the large and important branch that arises from the lateral side of femoral artery about 1.5 inches below the inguinal ligament. It passes medially behind the femoral vessels and enters the medial facial compartment of thigh. It ends become fourth perforating artery. At its origin, it gives off medial and lateral femoral circumflex artery, and during its course, it gives off three perforating arteries. The descending granula genicular artery. Next is support of uterus. Uterus is a muscular organ which undergo extensive changes in size and shape during pregnancy. It is supported and prevented by sagging by a number of factors. First one is the muscular factor. This is the pelvic diaphragm form levatorani and coccygeus muscles and they support pelvic viscera. Perineal body. It is a fibromuscular body situated at 1.25 cm in front of anal margin. It provides support to the pelvic organ. Urogenital diaphragm. It is from the sphincter of urethra and deep transverse muscles lying between superior and inferior layer or urogenital diaphragm. Fibromuscular ligaments. Pubocervical ligaments. These ligaments connect cervix to the posterior surface of the pubis. Transverse cervical ligament or McDonald's ligaments or scadinal ligaments. These ligaments fan out from the cervix and upper vagina to lateral wall of the pelvis. Round ligament of the uterus, there are two fibromuscular bands about 10 to 12 cm long. Each ligament begins at the corner of the uterus, run forwards and laterally. Peritoneal ligaments. Next is the transitional epithelium. Transitional epithelium is a type of stratified epithelium, the tissue of multiple layers of epithelial cells which can contract and expand in order to adapt to the degree and distension needed. The transitional epithelium lines the organs of urinary system and is known as uroepithelium. The bladder, for example, need a greater distension. Transitional epithelium made up of three types of cells, that is basal, intermediate and superficial. The basal layer fosters epithelial stem cells in order to provide constant renewal of epithelium. These cells, cytoplasm is rich in the tone of filaments and mitochondria. Tone of filaments play a role in attachment of basal layer to the basement of membrane via desmosomes. The intermediate cell layer is highly proliferate and therefore provides for rapid cell regeneration and in response to injury or infection. Classification of joints, it's also been discussed earlier. Then bronchopulmonary lung. Each primary bronchus on entering the ileum divides into branches which can divide separately. The tertiary branches are referred as segmental or bronchi. Similarly, pulmonary artery also divides repeatedly and accompany division of the bronchus. These segmental bronchus are accompany division of pulmonary artery and supply definitive part of lung. Entire unit is called bronchopulmonary segment. There are 10 bronchopulmonary segments in the right side. The upper lobe has 3 bronchopulmonary segments. They are apical, anterior and posterior. Middle lobe has 2 bronchopulmonary segments, medial and lateral. Lower lobe has 5 bronchopulmonary segments, apical, anterior basal, medial basal, posterior basal and lateral basal. There are 10 bronchopulmonary segments in the left lung. The upper left lobe, apical, anterior, posterior, superior, inguinal and inferior linguinal. Lower lobe, apical, anterior basal, medial basal, posterior basal and lateral basal. The applied aspects of the bronchopulmonary segment, usually infections are confined to each bronchopulmonary segment, but TB and malignancy break through septa and spread to the adjacent segments. If the segment is damaged by a disease, it's possible to resect that segment only. Next is blood supply to the stomach. The arterial supply to the from the branches of celiac trunk. The left gastric artery is the branch of celiac trunk which descends along lesser curvature between layers of omentum. Right gastric artery is the branch of hepatic artery, runs along the lesser curvature. It anastomoses with the left gastric artery and supplies the right half of the stomach. Left gastroepiploic artery, a branch of splenic artery, it descends along the greater curvature between the layers of greater omentum. Right gastroepiploic artery, a branch of gastroduodenal artery, which goes in the greater curvature between two layers of greater omentum and anastomoses with the left gastroepiploic artery. Short gastric arteries are 5 to 6 in number. They arise from splenic artery and supply fundus of the stomach. Venous drainage. Right and left gastric veins end in portal vein. Short gastric and gastroepiploic veins drain into the splenic vein. Right gastroepiploic vein drain into superior mesenteric vein. The prepyloric vein of the myope connect the right and left gastroepiploic vein and crosses the anterior surface of pylorus. So it forms an important landmark for surgeons in the identification of location of pylorus. Lobes of prostate gland. The prostate part of the urethra passes vertically through the prostate gland. The two ejaculatory ducts pierce the prostate surface of the prostate and open into the posterior wall of the prostatic urethra. In relation to the urethra and two ejaculatory ducts, the prostate can divide into 5 lobes. Posterior lobe, it is commonly involved in cancer. The median lobe consists of more glandular tissue than other lobes. It usually involves benign enlargement of prostate. Thank you. Thank you for listening.